Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of ICOS. And in this podcast, you'll hear from a diverse representation from our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. Well, welcome to another podcast that we are thrilled to have today. I want to welcome my co-host, Dr. Arjun Ghosh, consultant cardiologist at Barts Health Centre and University College London Hospital. And I guess it's now Professor Ghosh. Is that right?
Thanks so much, Steve. Yes, it is indeed. Thanks for that. Really nice to be here again with you, and very much looking forward to this episode as usual.
Yeah. Well, congratulations again on that. And I think one of the things that Arjun and I both really appreciate about being engaged with ICOS is that we really have this amazing global network. And we benefit so much by hearing about how cardio-oncology care has developed in various locations around the world. And so today we're really happy to welcome Dr. Suvro Banerjee from Kolkata, India. Welcome, Suvro.
Thanks, Steve and June. Thanks for having me here.
Yeah, great to have you. And India, like pretty much every other country in the world, is seeing a rapid development in the area of cardio-oncology. So maybe, Suvro, if we could just start by hearing about your personal background. How did you get engaged in cardio-oncology care?
Well, I've been working as an interventional cardiologist in Kolkata, which is in the eastern part of India, for over 25 years. Now, my entry into cardio-oncology actually happened somewhat by accident. A few years ago, when I first came across this specialty, I realized I knew very little about it. And that curiosity pushed me to explore it further. And as I began to learn more and to see patients with cardiovascular issues related to cancer and cancer therapy, I started to appreciate how important this intersection between cardiology and oncology really is. And somewhere along the way, I became deeply interested in it. So I wouldn't say it was exactly love at first sight, but the more I learned, the more I enjoyed working in this field.
Yeah, I appreciate you highlighting curiosity. I think that's a common denominator with a lot of folks who get into this space. They start seeing complex patient challenges, and next thing they know, there's a whole new world of exploration before them, and they get involved. Tell us a little bit about how cardio-oncology has emerged as a discipline in India and how it's growing there in Calcutta as well.
Well, cardio-oncology as a distinct discipline has really gained momentum only in recent years, I think. And in India, the growth has been somewhat gradual. Even today, only a handful of hospitals have dedicated cardio-oncology services. And in Kolkata, there are a few structured programs. In most cases, what happens, oncologists still refer patients to general cardiologists. And that too, usually after a cardiac problem has already developed. So referrals for cardiovascular risk assessment, monitoring during therapy, or for primary prevention are still relatively uncommon. But over the past 6 months, we have some important developments. For example, the Asian Cardio-Oncology Society held its second annual conference in Kolkata. And earlier this year, a dedicated cardio-oncology workshop was organized in Kolkata as part of the Global Cancer Consortium and ICOS programs. So these initiatives do help in building awareness and expertise in this field.
Yeah, we were really excited to have representatives from ICOS at that meeting that you just mentioned. Arjun, did you participate in that? I can't remember. Were you there?
No, unfortunately, I had a prior commitment, but I did see the program and it looked very exciting. And actually, I was in Kolkata very recently, last month, actually, and Dr. Banerjee's institution gave a talk there, had very fruitful discussions with a number of the medical and clinical oncology fraternity there. And I think along those lines, it's really great from the perspective of the listeners to find out about cardio-oncology in different places around the world. So I guess my question following on from this to Dr. Banerjee would be, what is a typical day for a cardio-oncologist in Kolkata? What are the challenges? I think you've already mentioned that sometimes awareness or discussion with cardio-oncology can be limited, but what are you doing in your practice to try and change this? I think the listeners would find that very interesting to know.
Well, speaking about myself, at present, cardio-oncology makes up about 10% of my clinical workload. And that involves mainly outpatient consultations, inpatient referrals from oncology teams, and occasionally participating in tumor board discussions when requested. Coordination with oncologists, I think, is very important in these cases. And cardio-oncologists and oncologists should work together to ensure that patients can receive the most effective cancer treatment while minimizing cardiovascular complications. But I think this would take time. It would take time to convince the oncologists that cardiologists are there to help them, not to stop any of their treatment. So I think that needs a bit of convincing. And I think we are gradually getting there.
It's really interesting to hear because we hear the same thing, Steve, Dan, and I, when Dan's on the podcast from around the world. It's always often this convincing act that needs to take place for the oncologist. But we also invariably hear that once that threshold is reached, the referrals actually can overwhelm the cardiologist and the cardio-oncology team. So I think there's some kind of point at which it very much goes the other way, which of course is, great for the patients, no doubt. And also just asking again about the experience in Kolkata. This is something that we often ask our participants in the podcast because they work in a variety of different healthcare environments. Some are insurance-based, some are government-based, some are self-pay. How does that affect your practice and how does that affect the care of the cardio-oncology patients in Kolkata?
Well, as you know, Kolkata serves as a major health hub for much of the eastern and northeastern India, where both cardiovascular disease and cancer are highly prevalent. And we do see a large number of patients who potentially would need cardio-oncology care. But in India, as you have just mentioned, we have two parallel healthcare systems. And the challenges are somewhat different between the two systems. The public sector, that's government funded and has a very high patient load, which means clinicians have limited time for the detailed risk assessment and monitoring that cardio-oncology ideally requires. Moreover, access to advanced imaging or cardiac biomarkers may not always be readily available in a public sector setting. On the other hand, the private sector, for example, where I work, generally offers these services more easily, but the costs can be significant and may place a financial strain on these patients who are already coping with expenses of cancer treatment. So I think balancing optimum cardio-oncology care with the realities of access, time, and cost remains one of the key challenges that we face in India.
Yeah, I think Arjun and I would both say you're not alone there. That is such a common story across the globe. The balancing of providing the best care under the right circumstances within financial constraints is just so challenging for everyone. I wonder, in Kolkata, in your experience, what are some of the most common cancer types that you are facing and dealing with there? I imagine it's similar globally, but we always like to know what is unique about the context in which you're serving.
Well, I think, especially in Eastern India, where I work, certain cancers like oral, esophageal, gallbladder cancers are actually more prevalent. I mean, the reason could be that they have a habit of chewing betel leaf. That may have added, I don't know, but that could be a risk factor. So these are the cancers, I think, which we see more often in eastern part of India than the rest of India. I don't know how's the situation over there, but I don't know whether you see so many patients with oral cancer.
Yeah, it's interesting. That is not what I hear in our region or in a lot of other locations. It's typically lung cancer, breast cancer, prostate cancer are top of the list. So that does seem to be a bit unique. What are some of the cardiovascular risks associated with treating patients with oral or esophageal or bladder cancers?
I think because the structures, the esophagus or the structures are more anatomically close to the heart and major vessels. So both the disease itself or its treatment can increase the risk of cardiovascular complications. Say treatments such as chemotherapy, radiotherapy, or even surgery in this region can sometimes affect the heart and the surrounding structures. And so I think that could be one of the reasons why we see a higher incidence of cardiovascular problems, such as coronary artery disease, heart failure, atrial fibrillation, or even stroke in some of these patients.
Yeah, that's again, as Steve mentioned, really interesting to hear. We always do find that there is some geographical variation. And I think, as you mentioned, the chewing of tobacco-like products is probably a risk factor in this context. And again, this is not really something that we see in the UK to that extent at all. And I think you mentioned a little bit earlier about being involved in some tumor boards and multidisciplinary type of meetings and structures. So is this something that happens on a regular basis, or is this something that you would like to happen on a regular basis? If you could give us some idea of how that may happen and who would normally be at such a meeting.
Well, ideally, I think a tumor board should be multidisciplinary, and they should have medical oncologist, radiation oncologist, hematologist, and cardio-oncologist. And there should be support staff as well. I mean, there could be radiologists, pathologists, palliative care specialists, even pharmacists or specialized nurses. But in Kolkata, for example, and I think in many parts of India as well, they do have, the hospitals do have tumor boards, and even complex cancer cases are discussed. However, cardio-oncologists are not always regular participants in these meetings. Now, the reason I do not know, it could be that we do not have that many cardio-oncologists available, or it could be some concerns that, as I've mentioned before, like a cardiologist may actually stop a particular treatment which the oncologists have planned. So these concerns may be there. But I think I would say as the field grows, integrating cardio-oncology more formally into tumor boards will be very important, because that would allow cardiovascular risk to be identified and managed early while cancer treatment decisions are being made. But we have to wait and see how things go.
I'd be curious to know, Suvro, in the United States and North America, I think generally there's a real move toward engaging the patient in the decision-making process. And I know that's not true everywhere for all sorts of sociological reasons, but I just wonder, what's the case in India? Is there an interest in bringing patients into the decision-making process, or how does that work?
Yeah, that's a very interesting question. I think these decisions are always made, at least in our hospital, through a shared decision-making process. Now, we try to present the medical information and objective data in a way that is clear and easy for the patient to understand. And also, of course, being sensitive to the situation. And usually we try to make these discussions in the presence of oncologist or a primary physician or nurse. But having said that, this do not always happen. But we try to make that happen. And of course, we discuss the possible treatment option, explain the potential benefits and the risks, and make sure that the concerns of both the patient and the caregivers are addressed. But one thing I would like to mention here, that in our settings, families often play a very important role in medical decision making. I think this may be a little bit different from that in the West, because sometimes family members may even wish to shield the patient from certain information or take a more dominant role in the decision making. So what we do, we try to clarify these expectations early on, so that the communication remains open and the final decision that is taken by the family truly reflects what would be in the patient's best interest.
Yeah, I think that there are different social and cultural nuances around the world, and always kind of interesting to hear the different viewpoints. And something from the ICOS side that we're always very interested to hear about is, again, research, education, and training aspects of cardio-oncology around the world. So my question now is focusing along those lines. Is there any particular areas of research that you are seeing evolving in Kolkata or India from the cardio-oncology viewpoint, or you feel that there's a particular topic that maybe India would be best placed or well placed to answer in the cardio-oncology context?
Well, I think much of our current understanding in cardio and oncology is still based largely from data from the Western population. So what we still do not know, whether all of those findings apply also to the Indian patients, who may have different risk profile, genetics, and other ways they may differ from the patients in the West. So that's why I'm particularly interested in collecting and analyzing Indian cardio-oncology data, which could eventually help us to develop guidelines or consensus statements that will be more relevant to our own patient population. And in this context, I'm happy to mention that I'm a founder trustee of a national organization called Association of Indian Cardiologists for Academics and Research, or simply ICAR. And one of its key goals is to promote the collection and analysis of India-specific cardiovascular data, which I believe will be very important for advancing research and even clinical practice in this field.
Yeah, that sounds really, really interesting. And I'm sure that if there are any ICOS members listening who would like to get involved, then I'm sure they can contact you. But that sounds exactly what many countries really need in this space. And coming to near the end of our discussion, if there's a young cardiologist or oncologist, a trainee who comes to you to ask, what is the future of cardio-oncology, or how can I get more involved in this? What would your advice be to them into how they can develop a career in cardio-oncology in India?
Well, cardio-oncology is a relatively new but rapidly expanding field. So with advances in cancer therapy and improvement in survival, the need to address cardiovascular complications is becoming increasingly important. So for young cardiologist or oncologist, I think this is a very exciting time to enter the field. And there are many opportunities for clinical work, research, and multidisciplinary collaboration. So what I would say, that if someone is interested in working, say, the intersection of cardiology and oncology, this is probably one of the best times to get involved and help to shape the future of this specialty. And I think considering the dearth of cardio-oncologists that we have in India today, this is something which I would think is very important for the cardiologists and the oncologists who are young and training in their respective fields to come forward and take part in cardio-oncology.
Yeah, this is such a great discussion. Thank you so much for your time and for your insights. It's always interesting to hear how there's so many similarities across the board. It's a rapidly expanding field. There's these financial challenges. You have to figure out how to engage fruitfully across disciplines. But then you have these unique features with different kinds of cancers and the process of engaging with families versus just individual patients. That to me is very interesting because I think in the West, we tend to be so individualistic rather than family oriented. So that creates a very different kind of decision making process, which I think is actually quite helpful. I really appreciate the conversation, and we always feel like we learn so much by these cross-cultural conversations around this field. So, Suvro, any closing comments or takeaways for our listeners?
Yeah, I would say with advancement in cancer treatment, patients are surviving cancer, but many developing cardiac issues. And I think the most important message that I want to put forward to patients and their families is that cardiovascular health and cancer treatment are not mutually exclusive. And this is where I think cardio-oncology comes in. It is a partnership which helps cancer patients not only survive cancer, but also maintain good heart health during and after treatment. And I think that's what my final message to the listeners would be.
Wow, that's a perfect message. That's a great message and one that we try to send all the time through these episodes. So thank you again so much, Arjun. Thanks for your time today as well.
Thanks a lot,
Thank you.
Steve. Great to hear the update of how things are going from my hometown. So really nice to be involved in this episode.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.